family or friend who has diabetes?
I do.
Yes. So you'll be equipped and empowered to educate them about what a podiatrist can do, because at the end of the day, we're all one big community trying to look after each other. So, how many people are diagnosed with diabetes? The results are quite shocking. So this statistics is from the South East Sydney Local Health District. That's basically the government's the government of New South Wales. This is the statistics for southeastern Sydney. How many people and rates of diabetes? So in the St George area, which is most of us here today, that's including Hurstville, Kogarah, Rockdale, and Botany Bay, and these are the numbers. Now, I did the calculations yesterday, and the numbers are 20.5%. 20.5% have diabetes just in the St George area. Now, compared to the New South Wales average of about 5.5%, we are 4 times more likely to have diabetes. That's more than 1 in 5 people in the St George area that you'll come across, that you'll meet, could be a loved one or a friend or yourself who has diabetes. So the numbers are increasing and they're alarming. So we really need to address this issue. So the St George area alone.
Have we come up with a reason?
The reason is, what we've seen is lack of education and ignoring the treatment. So people who have diabetes don't know that people like us, podiatrists, can do a lot to help them. Now, going further from these, okay, they have diabetes. What does that have to do with podiatry? Now, if you have a look at this statistic, also from the Southeastern Sydney Local Health District, which is the New South Wales government statistic, the 5th highest complication of diabetes is musculoskeletal and connective tissue. That's the 5th highest one. The first is eyes, as we all know, a lot of people get glaucoma and they can't see. Circulatory, that's also 2nd highest, also related to podiatry, and I'll explain to you why. But the 5th highest and the 2nd highest that's related to us with the complications to diabetes is something that a podiatrist can help you with. So going on from here, what are some of these complications? There are 2 main complications of diabetes, and they are called peripheral vascular disease and peripheral neuropathy. Now, we're going to go into what these big fancy names mean, but these 2 are the 2 biggest and sometimes most deadly complications that you can get with diabetes that goes unchecked and unmanaged. So, a few photos. I do warn you, I'm sorry that I know you've just had tea. Some of these photos are a bit graphic, but these are some of the patients that I've seen and treated at Bankstown Hospital and at Concord Hospital. And in my experience of treating these patients, if they had seen a podiatrist a little bit earlier, they could have avoided, most likely could have avoided being in this position. And as we all know, prevention is the best cure. So some of these people ended up with gangrene.
Oh my God.
So as you can see, the black tissue around here is gangrene. Gangrene is already dead tissue. You can't save that. What you have to do after that is amputate.
Ulcer.
Yes, exactly. The ulcers come up. As you can see, that middle toe has partially fallen off and has gone white. Unchecked and unmanaged diabetes can reach this stage and has. I've seen it and I've treated it at different hospitals. So we don't want to see people reach that stage. We want them healthy and walking. Other presentations of unmanaged and complicated diabetes is this. So here's had an amputation, and with peripheral vascular disease and peripheral neuropathy, we'll go through it in detail, but basically these 2 complications means that they don't have good blood supply to their feet, so they can't heal, and they don't have good nerve systems in their feet, so they can't feel. So they can't heal and they can't feel. These are the 2 big problems that lead to something like this, that lead to amputation, lead to injury,
So what
and
do you do about
lead
it?
to ulcers. So
What
we're
do you-
getting there to this stage. So just quickly going over peripheral neuropathy. Some of the symptoms are tingling, burning sensations, numbness, sharp shooting pain, and some of my patients that I've actually seen at Soul Therapy and at Bankstown and Concord Hospital, they have no feeling at all. So sometimes you get these feelings, sometimes you get next to no feelings at all. You can't even feel it. I've had a patient that I've treated at Bankstown Hospital. She's been seeing us for about 4 months. She's trod on a needle in the backyard while walking barefoot, cannot feel a single thing. She came to a podiatrist for a regular foot check, which is what we do here at Soul Therapy. This regular foot check, when we were going over, we noticed something was sticking out. It was all the way in. The needle was about this big. She had no idea it was there. So what we did was we assessed her, and getting your feet checked by a professional, you know, will prevent you from walking around with something in your foot, like as my patient did. She had to have surgery. She had to have a very long healing process because, like I said, peripheral vascular disease, peripheral neuropathy. Peripheral vascular disease means they don't have enough blood supplying your feet. So she's not healing. With no blood, you won't get any healing. You'll get the gangrene and an amputation. We almost had to amputate her foot. Lucky for her, she was good. She kept seeing her podiatrist regularly at Bankstown Hospital and outside the hospital as well for regular foot checks. And lo and behold, she's walking again and she's checking her feet regularly and she's wearing shoes. She's not walking barefoot. Okay, because you can't feel and you can't heal. They rhyme. You can't forget it now. Can't feel, can't heal. So, nerve damage can lead to ulcerations, infections, and amputations, as you guys have seen in the photos before. So we want to catch them early because, like we said, prevention is the best cure. Now, as we spoke about poor circulation, it's self-explanatory. These little arteries and nerves, like the ones in the eyes, are the most furthest from the heart and are the most fragile. So these are our telltale signs that, hey, maybe something is going wrong. And what we do as podiatrists and at Soul Therapy is we make sure that we keep an eye on these. We have special equipment, special machines to reassess these blood vessels and to reassess these nerves. It's very thorough and it takes a half an hour. And as well, we do a static and dynamic test, which I'll go through later on. So poor circulation is the peripheral vascular disease. Can't heal. Peripheral neuropathy, can't feel. Okay, so our role at Soul Therapy. Now, as Nicole mentioned, with chronic conditions such as diabetes, sometimes it's hard going to a podiatrist regularly. That's why the government, and rightly so, they've come up with an EPC scheme. EPC basically allows you to see us with Medicare covering the majority of the cost. What they usually do is cover the consultation fee, and then it's a small gap out of pocket, but they do cover most of it. And that enables people to see us more regularly as they need to avoid further complications, as you saw in the photos previously. So, who is eligible for this EPC scheme? Now, unfortunately, we don't do the assessment. You go to your local GP, he assesses you. If you have trouble reaching your feet, or if you've had long-standing diabetes, or if he thinks you're at risk of ulceration, he'll write you up a form. You bring this form to us, we'll put it through the Medicare system, and we'll see you, and it's 5 visits, carefree from the Medicare from the government. So yeah, the government's doing something right for a change. But yeah, so we have to go through the GPs first. Now, what happens if we still want to see a podiatrist, but we can't get that EPC plan? Nothing. You can still see us without this EPC plan. You just won't get that little bit of a boost from Medicare financially. But our doors are still open, and you can still see us to your leisure as you are as if you are concerned. But we are more than happy to come see you regardless. So yeah. Yeah.
So what do I have to do to get that EPC?
So you go to your doctor,
yeah,
and he's going to assess you and assess your needs. And if he feels like you need those 5 free visits to the podiatrist that have a small gap, so they cover most of it, but there is a small gap that you pay out of pocket, he will give you that form after he assesses you, and then you come to us.
Okay.
I'll be doing.
I think I can do that.
Yeah.
Yes.
Gives me questions.
Sorry, we'll just.
So when we go to the GP, just tell them all the pain.
Yeah, just tell him.
Everything, the pain.
Yeah, and tell him.
The knee.
That's right.
Okay.
That's right. And then he'll say, yes, okay, you need to see a podiatrist. He'll fill out the form for you, and he'll get
so
you.
So we request to see the podiatrist.
Yes, that's right.
Is it a podiatrist? Okay.
Yes, podiatrist. So. Now, we've briefly already answered this question, but I'll just recap. So, what are the benefits of seeing a podiatrist? In terms of diabetes, we're going to reassess your foot. So, we have you up in a high chair and we get to see anything and everything. Like we've also mentioned, we've done a master's course on just this area of the body. So, no one knows it better than we do. That's why doctors refer patients to us. So we'll be looking at your nerves and your blood supply. We also look at your nail and your skin conditions, because those are telltale signs of possible complications that might come up. We also provide you with general treatment. So someone who has a high risk of who's got diabetes, and maybe their blood supply to their feet and their toes aren't that good, because toes have the smaller blood vessels and they're the first to go. So what we do is we can do that general treatment. We can cut away the corn, the callus, the ingrown nails, which I'll go into further detail later on. And that way, you're not at risk of accidentally cutting yourself with a pair of unsterile clippers at home. All our instruments go through a very vigorous 3-step cleaning process.
That's right.
That is approved by A, the government, B, the association, and C, the Southeast Sydney Local Health District. In the hospitals, they have the same cleaning systems as us. So we can reach those areas better. We have cleaner and more specialized instruments to do that general treatment and to avoid you from cutting yourself. Because if you accidentally cut yourself or get an infection, remember, can't feel, can't heal because of the diabetes.
Yeah.
So any of your friends who are still taking care of themselves, offer them this service, because we can take care of them.
Also, you can get the